the service director for the Lambeth Living Well Network Alliance. So essentially, my role means I've got strategic direction leadership for the alliance. But
Individual, what are
Mhm.
your goals and objectives for people of Lambert?
Well, we want the people of Lambeth, to have control over their own mental health, and by that, we want people to be able to access services in the right time.
Ensure that mental health or
Is
mental
not
illness is not the next pandemic.
Oh, okay. So I guess just thinking about COVID, we had to do a lot quite quickly. But one of the things that was helpful for us is being in an alliance. We're able to work together in partnership.
About the Florence Nightingale Foundation. You also
Mhm.
mentioned about the NHS Leadership Academy. Can you tell me a bit about how those programs shaped your position now and shaped you as a leader?
Anybody under 40 listening, please sign up to a lifetime ISA now.
Hello, guys. So today I've got the honor of interviewing a very special guest, somebody that I've been looking forward to interviewing for a very long time. I've got Sabrina Phillips, and Sabrina is one of the directors at Living Well Network Alliance. And Sabrina is also a Florence Nightingale Foundation scholar. And most importantly, she's a mental health nurse. Hi, Sabrina. How are you doing today?
I'm good, thanks, Shola. Thanks for having me on your channel, and hi, everybody.
Thanks for coming onto the channel. Sabrina, I just wanted you to tell us a bit about your role with the Living Well Network Alliance and tell us what your day-to-day role entails.
Oh, okay. So I'm the service director for the Lambeth Living Well Network Alliance. So essentially, my role means I've got strategic direction leadership for the alliance, but also provide visible leadership and oversee budget. I do have a small team that I manage. I've got a team of six now. Initially, it was just myself and three other colleagues actually. And what we then provide is support for alliance partners that are within the alliance. So within the alliance, we've got partners from an NHS trust, we've got partners from what's now South East London ICS or Integrated Care System, the local authority, as well as two voluntary care sector. And we provide mental health services for adults of working age in Lambeth.
Oh,
And
that's
you asked about my day to day. So my day to day, um, it varies, but I guess a day in the life is I go in, I always have meetings from sometimes 8:30 in the morning to 8 at night, and this could vary from being in a board meeting to being in a team meeting, just meeting staff or having a webinar. So for example, today I started at 8:30 because we've got a weekly meeting that looks at the flow through the system, and when I say that, I mean in terms of people moving in and out of our inpatient wards. So I've got around the table partners from the trust, partners from voluntary care sector, as well as general managers from the inpatient and community, talking about patients that we want to support to get the right care at the right time. That was then followed by what we call a bronze meeting, which is essentially getting a sit rep or situational rep report on the different teams in the system to understand what the challenges are, and as a senior leadership team to understand what support we can offer. That was then followed by I attend the Lambeth Together exec board group, where again I give feedback, or my colleague, if he's there as the Lambeth director, would give another sit rep to the system, but also ask for any further support that we need. I did have a break between that meeting and the other. And then in the middle of it, we have what we call silver meeting, which is, reporting from the bronze into silver. And again, it's more senior leadership across the trust. And you mentioned I've done a Florence Nightingale scholarship. I've also done an NHS leadership academy training called Ready Now. So I was able to form a small group of alumni in the trust. So at 1 o'clock we had our alumni meeting because we're trying to develop what we're calling a BAME Academy. then after that, I think so. It's quite a lot of meetings, but they're either quite strategic in terms of understanding the direction of travel for the alliance, or it could be operational. So things that are going on with the everyday that myself and other colleagues might remove barriers. So frontline nurses, frontline OTs, etc., can do their jobs without worrying about, things that they don't need to worry about.
That's really good. And from what you've said, it appears that on daily basis you want to know what's going on in Lambeth, and
Yeah.
also what's happening within the inpatient setting, and what's going on with people with mental illness and distress within your catchment area, really.
Yes.
So, I mean, from the website, it appears that you guys, provide services to people with mental illness and people experiencing distress. For you as an individual, what are
Mhm.
your goals and objectives for people of Lambert?
Well, we want the people of Lambeth, to have control over their own mental health. And by that, we want people to be able to access services in the right time. And when they access it, we also want to ensure that they receive the right treatment that they need, but also get a good experience, because we do know if people are able to access services, get treatment, and get the right experience, that they're more likely to come back to us if and when they need to, and to provide really good, high quality mental health care for the people of Lambeth.
That's really good. As you're aware that there's no health without mental health. So
Yes,
it's very
yes,
important that we look after, we safeguard the mental health of our local people. So one of the
definitely.
videos that I've done on my channel is asking myself the question: is COVID the next pandemic?
Hmm.
For somebody within your position, how did the COVID affect people in your locality, and what are you guys doing to ensure that COVID is not the next pandemic?
Well,
Sorry,
I think
COVID, COVID. Sorry, what are you guys doing to ensure that mental health or
it's
mental
not.
illness is not the next pandemic?
Oh, okay. So I guess just thinking about COVID, we had to do a lot quite quickly. But one of the things that was helpful for us is being in an alliance, we're able to work together in partnership. So, for example, as we all know, in the UK, we went into lockdown in March 2020, which meant as services, we had to work differently. We adopted really quickly what we now look at as being quite normal. So working online using Microsoft Teams, putting our community teams into what we call pods, where we're ensuring that there were different members of the staff in at different times. So if the worst case scenario, somebody in that pod was to have COVID, then it would reduce the number of staff being off at any one time. Our inpatient services remained open. So within all this, although we worked differently, we remained open. We were, as per usual, following government guidelines around infection control. So things, at the very start, we're wearing personal protective equipment such as your gloves, your mask, ensuring where there might have been fluid or procedures where bodily fluids were involved. People will be wearing different types of masks. Social distance, as colleagues might remember, at the very start was very important. So we, in rooms, we colleagues were going around measuring 2 meters, removing seats and computers. But more importantly, thinking about the patients that we looked after was really important, that we stayed in contact with them. So there was communication sent out to let people know how to contact their, whether if they're in the community care coordinators, to let them know how to access services within crisis. Initially, we sort of not redeployed, but staff were moved to different areas where it was felt that there was the need. I remember at the very start, I wasn't in this role at the time. I was the program director for the Alliance, but there was an ask to have a senior manager on site. So I volunteered to be one of those people. So I was going in on a Saturday or Sunday and a bank holiday, just going around checking one, board teams are okay, that they had enough PPE, and helping with that. So there was a number of things that we did, but following the guidelines that the government passed out. By more importantly, ensuring that infection control was well. And as things moved forwards, as we moved out of lockdown and social distancing reduced, it was only until recently that we stopped wearing masks within services. And you might remember few weeks ago, there was an increase in COVID cases. So we went back to universal mask wearing. And again, bringing our service users along and explaining to them what the need was. Again, and this is inpatient wards. I know at the start we did have COVID specific wards where people who were positive were moved to, but also informing people or supporting service users to social distance, to wear masks, to self isolate where needed, and doing the lateral flow test and PCR test for everybody that was admitted, everybody that was being discharged. And we had quite strict regimes around that. So there was lots of things that were in place then that are still monitored now. So we still, do testing for staff. I think twice per week. Um, the testing for patients is not as strict, so we had to do I think 3, 5, and 7 days, but there is still testing to ensure that people are safe. But we don't have COVID specific wards anymore. But what we do use is what we call the duty of candor. So if somebody's being admitted and there's somebody that's positive on the ward, i.e. a patient, the person is informed so that they know what they're getting into. And also the service user who might be positive would be supported to isolate and wear masks. So what we do know, I think a lot of people faced lockdown. It was quite isolating. Not everybody had were fortunate enough to have outside space, or that connection, that human connection is really needed. So what we are doing to ensure that we don't have another mental pandemic, but mental health has always been there, and I think it's really good that we're thinking about it and talking about it. But we're really keen for people to know that our services have always been open. They're always open. We've got in Lambeth a single point of access team where people can self-refer. They can either go to their general practitioner to get a referral, or if they've got a loved one that's concerned about them, once they've given their consent, they can refer in as well. You would see on the website we've got information on about how people can access the Maudsley Crisis Line as well, which is open 24 hours and staffed by nursing staff. They then have access to what we call the CAT team, which is a crisis assessment team. So if they're speaking to somebody on the phone and it's really serious, the CAT team will go out with the police and an ambulance. A nurse, a mental health nurse, will be there to do a triage and signpost to the right place. More recently, we have been at the Lambeth Country Fair, one to talk to people about the services that we offer, but also to do simple things like blood pressure checks, because physical health and mental health are quite interconnected. So for me, it's about, one, reminding people that we are here, how they can access it, but also talking about it and sharing the knowledge about mental health and what to look out for, because I think sometimes people don't know. One thing I would say here, especially because I work in Lambeth, where we've got a big Black African and Caribbean population, and what we do know is Black people are represented in the stricter ends of mental health. And what I'd really like is for our community to come out and access services in a timely manner, to understand what mental illness is or just mental well-being, to talk about it, to not be afraid or ashamed if you've got it, because it can affect any one of us at any one time.
Yeah, no, that's really good. I mean, from my experience, I know that ethnic minority tends to access service at a very crisis stage, and
Yeah.
a lot could have been done to sort of avoid things like hospital admission, inpatient, and so on and so forth. So, that's really good. What you guys are doing in Lambert. I mean, for me personally, within my role, I work for the CCGs. What we
Okay.
saw during the pandemic was an increase in hospital admissions
Mhm.
due to things like social isolation, due to things like people that used to be on the bus used to be on the street are no longer able to be there, and they have to sort of find a place of abode or place to reside. And
Yeah.
what we saw an increase in hospital admissions, and also what we did in order to manage that was to actually allow people to use what we call personal health budgets in a different way. So people were able to use PHB for laptops, for
Mhm.
iPads, for TVs, because prior to the pandemic, some of these people might not feel the need or might not even have a phone.
Yeah.
And as you know, that some of our patients see the ward or the inpatient setting as a place of security. And I think what we saw within the Midlands area was an increase in hospital admissions. But I think what you guys are doing going forward to ensure that the mental health crisis, not the next pandemic, is really good and really important. I
Yeah.
think the next thing that I wanted to talk about is you mentioned about the Florence Nightingale Foundation. You also
Mhm.
mentioned about the NHS Leadership Academy. Can you tell me a bit about how those programs shaped your position now and shaped you as a leader?
Okay, so I'll talk firstly about the NHS leadership one because I went on that before I went on the Florence Nightingale. And I guess a bit of backstory. So, the reason I found out about this was a colleague at work had actually sent it to me. She was one of our human resources lead. So, there's something for me about how people like us can access that information. But I was lucky enough that a colleague saw this and thought, "Oh, Sabrina, go for it." So once I read through the criteria, I spoke to my line manager, who was very very supportive. So I then put in an application for it, and I think at the moment the course is on a hiatus, but I think they're looking at rolling it out again soon. So we, people can look into doing it. So put in it was a written application, and then I got an email to say I was shortlisted for it. But you had so the in and then there was an interview. There was an interview like no other because it was a video interview that essentially they sent you a link and you had to record it yourself. So they sent you the link, you tested it out, and I think they asked 3 or 4 questions. And again, it wasn't your bog standard interview. It wasn't questions like you would get, like why do you want to go on this academy leadership course. There weren't questions like that. It was questions such as why I thought, and this is me trying to remember things like why this course, but also what I thought it would help, how it would help me in my own career. So I think what was really important is having read the criteria and rereading it before I did the interview was helpful, but also speaking about why I saw this course fitting in for me from my from the heart. I think also helped, but also a lot of these courses are geared towards people from Black, Asian, minority backgrounds. And the reason for that is, as we would see in the workforce race equality standards, that there's not a lot of people that look like us in the higher bandings in the NHS. So it's sort of courses to support us. And when I say that, I don't want people to think that black people come from a deficit position in that we don't have the skills, knowledge, and experience. But there's something about a course like this that sort of helps you to tap into your strength. So got did the interview and luckily I got accepted onto the course, and it's a very competitive course because they had 3 cohorts of which there were 40 people within that. And I think the beauty of this for me was that I met for the first time 40 people, including myself, from Black, Asian, multi-ethnic backgrounds who worked in different parts of the NHS systems. We had psychologists, people working in NHS England, NHS Improvement, GPs, gynecologists, lawyers who worked for the CQC. So it was just great to be in that space because there's not often you get into a space where you've got people like us in these different roles, but also the way that the course was structured really got you to tap into your own strengths. So we did things like 360-degree feedback, where you get colleagues to feedback on how you saw yourself and how others see you in areas where you might want to improve. You then went a bit deeper, and was tasked, and I won't try to tell all the secrets of it, but there was bits where you then would then choose three people and get another colleague to ask three questions about you to help further with your development. There was an element of theory as well. So, we learned things about different leadership styles. We learned things such as yeah, so there's different leadership styles in there, but also we did things like reflecting on our own selves as a group, and other bits. We also did a 1 day of what's called RADA, which is using drama as part of your being a leader. And also we had a board experience where we had actual directors of nursing, CEOs sat around a table where we had to put forward a business case based on real life situations. So I that was really enriching, because one, I was able to form a network that I'm still in contact with today. I did that course in 2019, oh no, 2018 to 2019, and we're still in contact. So we WhatsApp each other, and I might say, Shola, I'm thinking of this, and then somebody would ping out some information. You get a smaller network group again who is your guide. And again, we've always tapped into each other for interview stuff. One of my colleagues sent this script that she used for negotiating your pay. So it's been really beneficial. But what I think that it's done for me is really think about who I am as a leader and how I want to be seen and felt as a leader, but also how I in my role can bring about change within the system and the organization. So I think that's been really helpful. And as I said earlier, I've come together with a group. There's about 11 of us who've either been on the course or about to go on it, to look at how we can develop something within the trust that I'm linked to, so other colleagues can feel the benefit of what we've done. The Florence Nightingale, now that I saw this on social media actually. Our chief nurse at the time, I think, had tweeted it out. And what I remembered a few years ago, I was at one of our internal nurse conferences, and our now chief nurse was a modern matron at the time, and she'd done one of the travel scholarships. So, and then I've got a friend as well that had done the course. So I looked at it, then again, read the criteria, and one of the things that you have to do is get agreement by your chief nurse to sign it off, as well as your manager. So I contacted my chief nurse, and she was really pleased, and really gave her heartfelt support behind that. My manager was the same. I then spoke to my other colleague that did the course, because within, when you read on the website, but also the application form, and which I put in as well, I talked about how I'd spoken to other scholars, and everybody had such positive things to say about it. I applied for the emerging leaders part of the course, because I think there's aspiring directors, and there's another level as well. And for that, for the aspiring leaders and the directors, you once you got it, you were allocated £10,000 to develop training or course around what you needed as a nurse leader. And that was, so the reason I went for the Florence Nightingale was because it wasn't specifically geared towards nursing nurses. Two, I'd had really good feedback from it, and three, they were really keen to get one of the things I had to do as part of the course was a quality improvement project. And anybody that knows me knows I love QI, so it just really tied together. I then luckily got shortlisted, and again the interview process different. So what they did is there was six of us in a room, and that was a time when we could do face to face. So I think it was December 2019 that I did my interview, went down to the Florence Nightingale headquarters behind Oxford Circus. So there was the six of us who were shortlisted, and we had a panel of four, one being the CEO for Florence Nightingale, and some other, one being person doing the course, and some alumni. And what we had to do, so that we were tasked with doing a 5-minute presentation on our QI project, and then the other five colleagues who were there would then ask you questions. The panel just sort of observed. So you didn't get an interview, if that makes sense, but it was a group interview. So you got to hear all the other people's presentations as well, and ask questions. And again, another tight competition, and I was quite fortunate to get onto the course. And I think, again, for the whole cohort of us, there was less than 40. I think I was one of two mental health nurses that were part of the cohort, so very, very fortunate. Um, I said 2019. So when we started our course, it was during lockdown. So a lot of it was done online. But within it, we got 3 days of, no, 2 days of RADA, which again is using drama as part of your um, work. We also got a 360, and there was another leadership um, analysis that we did, and you got feedback to understand where you best work. So again, there was tips about how you might work with different people who like data, who like the qualitative side of things. So I thought that was really good. But also, I chose to do a further 3-day RADA course on executive presence for women, because that was one of the areas I thought I could do better in terms of how I present myself, get my message across, and influence. So that in a nutshell are those two. And like I said, the leadership one for me was great because it was leaders from all across the NHS, and specifically for Black Asian people. The Florence Nightingale different because it was more about the nursing bit and me as a nurse leader.
No, that's really good. That's great. No, I think from what you've said, it appears that it's a very great experience, and one that it appears that you truly enjoyed.
I have, and I keep telling anybody that would listen to apply for them.
Yeah,
So yeah.
that's really good. One of the things that I saw in one of your videos is about mentorship, and I
Yeah.
know that from the courses that you've mentioned or the programs that you've mentioned, I believe that mentorship was quite important in both. Can you tell us a bit more about the importance of mentorship within the nursing industry, please?
Well, I think it is really important, and what I find interesting, just reflecting on it, is as a student nurse, you are allocated a mentor as you go through your training. But soon after, and this is just me reflecting, you sort of, well, I didn't really seek out mentors. I might have sought out advice from people, and then only more recently realizing they were actually mentors, because as a mentor, you use your experience to guide the person that you are advising. So, which is different to coaching, where you'd ask that question so that that person can come to the solution themselves. So I think it's really important, because in each stage of our career, we do need some guidance. We do need people who have gotten to those positions that we might want to get to tell their story about how they get there, or to give us advice. Sometimes it's things that you don't want to hear, but you need somebody that really has your back, and will support you around that. But also, what they also can do is link you in to their own network, and speak your name in spaces where you might not have the opportunity to be spoken about, and then in that way they start sponsoring you because they are vouching for you as a person. So I think it's really important, and I always encourage people to seek out having a mentor. The worst somebody can say is no, but also recognizing that you don't have to have the same mentor throughout your career either, because you will need different people at different stages of your life. And I always say to the people I who are my mentors. I expect them to outdo where I've got to. And what I'm trying to do is create an elevator for them where they don't have to climb a ladder or take the hard way to get to where I've got to. So for me, it's really important. I really do encourage people to access mentorship, but if also if you're in the position to offer and be a mentor for somebody junior, do it as well, because it's a two-way learning. I learn so much from my mentees all the time. And I guess for me, that's the joy of this job. I get lots of joy out of doing that.
No, that's really good. So for somebody from an ethnic minority background who is looking at an organization chart and who
Mhm.
is getting fed up or giving up that perhaps there's a glass ceiling somewhere there, what would you say to them? What is your advice to them?
Well, I think there's something about for me, and I'm stealing the words here because sometimes we don't need to stay where we're not wanted, and that might feel like a really hard truth. But if I think there's some, and I've heard of people who've applied for 17, sometimes more roles and keep getting no, and it might, and in the same organization. So there might be something about maybe looking elsewhere, looking at other organizations where the organizational chart, as you put it, looks a bit more representative of yourself or the people that you work with. The other thing I always say as well is sometimes we need to also reflect on what we might be doing or not doing, because there we can all learn. I take each day as a learning day. I don't know everything. So I always think about what can I do differently. And if I think I've done all that I can, then I start thinking what else needs to be done. So there's something about reflecting on what you're doing. If you're going for interview after interview, make sure you get some feedback. And I don't mean a 5-minute telephone call after the interview, really. And sometimes people, I know people have asked and they haven't got it, but really try and push for that, because again, in every no that you get, there's some learning that you can do there. Get a mentor, get a coach maybe, because it might be, and again, it's I'm not placing the blame in people, but there might be ways that you can interview that would really get you that role, because interviews are quite daunting. I I had executive coaching to get this role. I didn't do it on my own. So I'd say reflect on what you might want to do differently, get some feedback, think about not staying in that organization if you keep getting no, or go to somewhere that you're wanted. But more importantly, if you do need some help around the interview process or coaching, do seek that out as well.
That's really good. And I think your answer also takes us back again to some of the programs that you've done in terms of having that network of people,
Yeah,
especially with the NHS leadership program. I think that was really good in actually creating a network of people,
yeah,
because sometimes when people want to climb, it's very difficult if they don't have somebody to talk to who's been there. And I think especially particularly with your area, Lambert, I think representation is very important. And I think, I've looked at the organization charts within your area and it appears very, very diverse, which is really good.
yeah. And the other thing I think and this is what one of the things I learned on the leadership course is
Mm.
as well, we sometimes think that if we work really hard, we will get the job. But what we don't realize is not a lot of people know the work that you're doing. So you need to find some sort of format to talk about what you're doing so the people know what you're doing. So there's the pie. So understanding when you're not there, what image people have about you, what's the impact that you're having, and talking about that. But also, yeah, so there's something about getting out what you do, the impact, and being able to influence in different ways. So it's not just about working really hard. That's at least 30% of you getting any job. And again, it's about saying that in an interview as well. You cannot assume because you've got shortlisted and they've read your JD, and that if you don't say it on the day, you can't get the mark. So it's that as well.
That's really good. That's really good. So for Sabrina, for somebody in
Yeah.
your position, what sort of banding are we looking at?
So I am currently a band 9 in the NHS.
Okay.
Yeah.
For somebody who is a band 9 DNHS, what do you do in your spare time and what do you spend your money on?
Well, I love traveling. So more recently, I was away because I had to be away. But I love like before the pandemic, I was everywhere, and I think for me, I like traveling because I like new experiences because it broadens my horizon. I like I love afternoon tea with my friends. um, yeah, so traveling, afternoon tea, and more recently we just got our garden done. So again, that's a nice space to sit out and do. But that aside, before I do the traveling and the this and the that, I always save. So I when I get paid, money goes into my saving. I more recently started investing in stocks and shares, ISA. And for anybody under 40 listening, please sign up to a lifetime ISA now. Pay even £1 in because you could pay up to 4,000 per year, and the government gives you back 25% of that. So that's £1,000 free technically, up until you're 50. So between the age of 18 to 40, you can get that and you can use that money towards buying your first home, which is what I did. But also, once you've done that, you can continue saving, which is what I've continued to do, and get dividends or interest on your savings. So save and then enjoy, save and invest and enjoy
That's
life.
really good. The reason why I've asked you that question is obviously, as you know, my channel is all about
Yes,
nursing and finance. To
yeah.
round up this conversation, I just wanted you to talk a bit about pension within the NHS and the importance of pension for
Oh
people
my.
from ethnic minority.
So I remember when I came here, if it's one thing, and I don't know if it was my mum that said it, but ever since I've worked, I've paid into the pension. So I started in 2004. So I've always paid into the pension because the way I see it, today or tomorrow, um, I I get sent somewhere which is going to be home. The ratio is about 1 to 3 at the moment for a Caribbean. But also back then I wasn't saving as much as I am now. So that is a cushion, in terms of when I get older and we can't do the hours that we are so used to doing. That is your fallback. I know there's arguments about when we get to whatever retirement age that they want to put on our lives, that there won't be the money. But I think that's where you have to think about having a second plan. Are you planning to work until you're 65, 68, or are you planning to do other things as well as have your main income? So I can't impress enough about people saving. One of the sad things I found out during especially the pandemic and COVID is some of our nursing colleagues that died didn't have a pension, which meant that their families couldn't even inherit anything from their sadly and untimely death. And I think following that was why I think the government set up like there was a fund that they set up, wasn't it, for people that died. So for me, I've seen my figures. It is very healthy, but that's the other thing. Once you pay in, you can have access to your yearly reports. Have a look at it. You can even go on, and it tells you if your state pension, if you were to retire. I think a few years ago it was 6,000 a year. I think now it's a bit more, but I've got quite, like I said, I've got quite a healthy pension because I've been paying since I've been 24-ish. And also, I think after you pay for 25 years, isn't it? So I've only got a few more years to go, guys. But definitely pay into a pension, get a lifetime ISA as well, because that too can act as a second pension. And I've got both.
That's really good. That's really good. And I think it's all about making sure that you're safeguarding yourself and
Yeah,
thinking about the future and making sure that
yeah,
you're putting those all important plans in place. Sabrina, I know you've got a YouTube channel.
yeah.
Can you tell people what the name of your YouTube channel is and what they should expect from your channel?
Great. So my YouTube channel is Sabrina Phillips, and I try to give tips around how you can skyrocket your nurse career. And I haven't done any hair stuff yet, but at the moment I'm just concentrating on supporting as many nurses as possible to get where they want to in their career goals. So do come over and see me there. And I try to respond to all the messages that people do send in as well.
Oh, that's really great. Thanks a lot for your time, Sabrina.
So thank you, Shola.